Good afternoon, everyone, and thank you for joining us for the Wagner College vaccine webinar. My name is Dr. Chris Corbo. I'm the Assistant Provost for the Health Science Initiatives at Wagner College. I'm also an Associate Professor of Microbiology in the Department of Biological Sciences, and I'm the co-chair of the Higher Education Health Analytics team. At the start of our fall semester, after having such a jarring spring the prior before and summer, we knew that it was imperative that the colleges really think about how to safely educate students. And Wagner College, along with the two other colleges on Staten Island, St. John's and the College of Staten Island, part of the City University of New York, came together with the Borough President's Office and the two local hospitals to work out a committee that would be able to share ideas, discuss infection rates, and really start to investigate and think about how to safely work within our confines, how to really bring public health to the forefront of college campuses, and really learn how to handle the very complex issue that was and still is COVID-19. Now, almost a year later, we are now rolling out a vaccine regimen all over the world. And we at Wagner and on the HEHAC committee thought that a vaccine webinar to share some information, both at the national level as well as in our local community level, and as well as seeing some background from health professionals, giving people a little bit of background and a little bit of information around what they can expect and what they could be doing. So we are lucky today to have three panelists with us. Dr. Douglas Fish is the Chief Medical Officer for the New York State Medicaid Office. He's the co-lead at the Jacob Javits Center COVID-19 mass vaccination site with the New York State Department of Health. Dr. Ginny Mantello is the Director of Health and Wellness for the Borough of Staten Island. And Dr. Tracy Jackson is the Director of the Physician Program at Wagner College. So we're going to get right to our presentations. Dr. Fish will be starting, giving us a background on vaccines and vaccination. And Dr. Fish is as I said, the Chief Medical Officer of the Office of Health Insurance Programs, otherwise known as Medicaid, in the New York State Department of Health, where he has worked for the past 6 years. Doug is currently serving as the New York State Department of Health co-lead at the Jacob Javits Center COVID mass vaccination site. Dr. Fish previously spent 21 years in the Department of Medicine at Albany Medical College and was the medical director of the Division of HIV Medicine and the hospital's AIDS Center. He is board certified in internal medicine and infectious disease and remains affiliated with Albany Medical College as an associate professor of medicine. Dr. Fish, we look forward to your presentation.
Great. Well, thank you very much, Dr. Corbo. I greatly appreciate it, and good afternoon, everyone. I'm happy to be able to talk and provide information about the COVID mRNA vaccines that are currently available. And in fact, I'm on site. I've been at the Javits Center, and today I'm at the FEMA site here in Brooklyn at the Medgar Evers College, and we're setting up to open up tomorrow. So as you know, we have had a major problem in this country over the past year. The death toll yesterday topped 500,000. So vaccination is really our strategy here. It is our strategy to prevent influenza. It's our strategy to prevent COVID infection and to stop the spread in this pandemic. On the next slide. So we'll just cover some vaccine basics. We'll talk about vaccine efficacy of both the Pfizer and Moderna vaccines, what we know about the safety data and potential side effects, and then who can and who is not yet eligible for vaccination under New York State guidelines. Okay, next slide. So vaccine stimulates the immune system to produce an antibody response. These antibodies can be antibodies against a virus, they can be antibodies against bacteria, but they're basically done to prime our immune system to stimulate that antibody response so that we're protected. As you know, routine immunization has led to near elimination of wild poliovirus, smallpox, and other vaccine preventable diseases. And few people now experience the side effects of some of these diseases, such as measles and tetanus, as long as they have been immunized. We still see them, but not to the extent that we did in the pre-vaccine era. On the next slide is what the reasons are to be vaccinated. We're protecting ourselves individually. We are also protecting ourselves. If we do get the infection, they can modify the course of illness and make it less severe so that we don't have severe complications or require hospitalization or ventilation. And they can also prevent the spread. So if I don't acquire COVID, then I don't spread COVID. To get community protection, we really need what's called herd immunity, and that's averaged, meaning that 70 to 90% of a population, depending on the particular pathogen or infection that you're talking about and the vaccine that you're talking about, but 70 to 90% need to be vaccinated to develop that community protection. And this is modeled after previous mass vaccine campaigns, such as for smallpox and polio. On the next slide. So this COVID vaccines, the two that we have currently, are a new mechanism of vaccine. They're a messenger RNA vaccine. So they utilize the same process that cells use to make proteins or the antibodies, and they're made against a particular element of the SARS-CoV-2 or COVID virus, the spike protein. And while it's a newer technology for vaccination, this has been studied now for more than a decade. And importantly, this mRNA, it stays in the cytoplasm. It doesn't get into the nucleus of the cell. It is not able to interact with our human DNA. And so there's no risk in terms of genetic interference from the vaccination. And then the mRNA from the vaccine is broken down and cleared naturally by the body. These have all been rigorously tested through clinical trials, phase 1, 2, and 3 clinical trials before being authorized for use in the US. And I think it's important to remember that these do not contain live virus. You cannot get COVID from the vaccines, and they do not interfere with the COVID test, so they do not make a test falsely positive. As I mentioned earlier, the two mRNA vaccines that are currently authorized for use by the Food and Drug Administration are the Pfizer-BioNTech and the Moderna vaccines. On the next slide, we'll talk now about those vaccines and their efficacy from the clinical trials. And so first is the Pfizer-BioNTech vaccine. So this, in its studies, after 2 doses, was 95% effective. You may have seen some recent studies out of Israel that suggest that maybe even after 1 vaccine, it may be 85 to 90% protective. But after 2 doses, 95%. This was a study that was based on 170 cases that occurred in the trial. So that means that there were 172 infections. 162 of those infections occurred in the placebo group, 8 occurred in the vaccine group, owing testimony to its efficacy, which was 95% in participants who had had previous or had not had previous COVID infection. And this similar efficacy was observed in older adults. So we always worry about vaccines being less effective, but in those age 65 and older, it was still 94% effective. And this was consistent across age ranges, gender, race, and ethnicity groups. There were 10 severe cases of COVID infection, meaning people required hospitalization, and in some cases, greater intervention. 9 of those severe cases occurred in the placebo group, 1 in the vaccine group. So it's also true that it likely protects against severe disease. So that's the Pfizer vaccine. That's what is available at many of the state or all the state point of dispensing or pod test sites. Many of the community pharmacies and other sites have the Moderna vaccine. This primary efficacy endpoint was prevention of symptomatic COVID infection. Its efficacy rate was 94%, 2 weeks after the dosing of the second dose. This was based on 196 confirmed cases of COVID-19. And out of those 196 cases that occurred in the trial, 185 were in placebo, meaning they got saline, they didn't get real vaccine in the blinded studies. And there were 11 cases of COVID in the vaccine group. Again, this was consistent across age and race, ethnicity, and gender groups. In case of that secondary endpoint of preventing more serious disease, there were 30 severe cases of COVID infection in the placebo group, none in the vaccine group. On the next slide. So now we'll talk about the vaccine safety and potential side effects that can occur. So if you go to the next slide, Most common are simple side effects that occur after many vaccines, including the flu vaccine. So local pain at the injection site. People can get headaches. Up to 40% have fatigue after the first dose. And we are seeing a higher side effect profile after the second dose, particularly in younger people. It seems like the older folks, people 65 or 75 and older, have fewer side effects than younger populations. Fever and or chills, these again don't occur in everyone. I didn't have really anything except local pain at the site, but one of my colleagues, a physician, he had a fever of 102 for 36 hours. Out of concern that he maybe have COVID, was also tested for COVID to be sure he didn't have COVID. That test was negative. It was vaccine effect, and it went away after about the 36 hours. Most do resolve within 1 to 2 days. We have had more severe allergic reactions that can occur with any vaccine, and they tend to be more common and potentially more severe after the second dose again, rather than the first. On the next slide. That's the Pfizer. Moderna is similar. Injection site pain in up to 80%. Fatigue up to 40% after the first dose and 80% after the second. And fevers and chills can occur as kind of that muscle achiness or soreness, joint pain, headaches. Again, most of these were mild to moderate. More severe allergic reactions were reported in some groups outside of the clinical studies. Next slide. So the most serious reaction that we worry about is anaphylaxis. So a severe allergic reaction similar to when people have a shellfish allergy or a bee sting allergy where they develop hives, what we call urticaria, hives and itching, or worse, shortness of breath, lip swelling, throat swelling, trouble breathing, and can even require sometimes life support or intubation. So this typically occurs very shortly after the vaccination, within 5 to 30 minutes. And the range you can see there can be within 2 minutes up to a couple of hours. So this is that sensation of the throat closing. People may have difficulty breathing. They may have wheezing, develop swelling in their face or their lips, and then get gastrointestinal side effects. And then they develop a high pulse rate. They can drop their blood pressure. And these are indications for epinephrine. So you always want to have epinephrine on site and available at vaccine sites, which we do. And again, not all of these symptoms are necessarily present in any given individual, and it can begin with mild symptoms and progress, and that's why we do intervene early with epinephrine to prevent that progression. If someone does get an EpiPen, we are recommending they be transported to the hospital because there can be a biphasic component. These symptoms can recrudesce or recur an hour or two later, and so people are observed for a period of 4 to 6 hours after if they've had a reaction that required epinephrine. And importantly, if they have this reaction after the first dose, FDA and CDC recommend that they not get a second dose. You don't want to expose yourself to a risk of a life-threatening reaction for something that is a preventive for a disease that you might not get anyway. The next slide. So this is a VSafe card that we're giving to all people who have been vaccinated. This is through the CDC, where people can download this app. It's a smartphone-based tool, and they can report side effects that they get. And the CDC is encouraging this so that they can just get more information about the vaccine and vaccine safety as we use more of the vaccines. And then this sends text reminders and checks in with people to see how they are doing and gives them that opportunity. And it also gives them a reminder for when their second vaccine is due. There's a Q code to access this or a website. So this vaccine sheet is given at the vaccine stations so that people have this information. Next slide. We are also at the state sites and the city sites reporting through VAERS, the Vaccine Adverse Event Reporting System. Again, this is a vaccine surveillance program that's set up. This is where we as healthcare professionals will enter that data. That's a site that's sponsored by both the CDC and the FDA. And this collects information about reported side effects or serious adverse events, such as anaphylaxis, that occur. Anyone can report through VAERS, but vaccinators, we are required to report these serious adverse events or vaccine administration errors where there was a complication from the administration itself, and they can be submitted online or over the phone. On the next slide. So who can and cannot get the vaccine? So as we know, there are age eligibility criteria for all vaccines. So the Pfizer-BioNTech is approved for 16 years of age and older. The Moderna vaccine is approved for 18 and older. These and other vaccines are also being studied at younger age groups, at least 12 and up, and pediatric studies are going on in some newer vaccines. But these are the current age ranges for the vaccines that we have. We are in phase 1 and 1A and 1B in New York. So the groups who are eligible for vaccination includes those who are 65 and older, those who have fit the occupational criteria of being a healthcare worker or having public-facing jobs, and all that's available on the New York State Governor's website. And then the third group that came on board most recently is those with chronic conditions. So what we call the comorbidities. So these include common things such as high blood pressure and diabetes, as well as other things, chronic lung disease, what we call chronic obstructive pulmonary disease, COPD, or even moderate to severe asthma. Obesity is in that list, and other chronic conditions. Cancer, a history of cancer, all are current eligibility. So when people register through the state site, they are asked these screening questions, and if they meet, and the eligibility is really an attestation. It is a self-attestation. We're not requiring proof at the state sites of a diagnosis. People are self-attesting that they have these conditions if they're using chronic conditions as their eligibility. On the next slide. So contraindications are those conditions that increase the risk for a serious adverse reaction. And so if we know these things, then vaccine should not be administered. So any anaphylactic or severe immediate allergic reaction after a prior dose of an mRNA vaccine. So since these are the first ones that we have, it would be after their first either Pfizer or Moderna vaccine, or an immediate allergic reaction to elements that are in the vaccine, such as polyethylene glycol or polysorbate. Most people would not know that they are allergic to these items, but polyethylene glycol, PEG, is a component of some of the preparations that are used for colonoscopy, for example. So most people aren't allergic to those. They get the induced side effect of the diarrhea to cleanse the colon and prep for colonoscopy. That's not an allergic reaction. But if someone were known to have a reaction to one of those ingredients, that would also be a contraindication. And a full list of what's in the vaccine ingredients is listed at this website. Next slide. An immediate allergic reaction is any signs or symptoms that occur within 4 hours following administration. These are hives, so that rash, those bumpy rash of red spots that occur, throat or facial swelling or eye swelling, wheezing or difficulty breathing, or anaphylaxis, where the body just drops blood pressure, pulse goes up, and people can lapse into unconsciousness from anaphylaxis. So if there's any question after the first vaccine, we are asking people to talk to their primary care providers and may need to see an immunologist or allergist to determine if it's safe for them to have a second COVID vaccine. Next slide. So these next few slides are things that are not a contraindication nor a precaution. So having had COVID infection is not a contraindication. If people currently have infection or are exposed or in quarantine, they need to wait 10 days before vaccination. This is probably the most common question that we get. So past COVID infection is not a contraindication. If they're currently have an active infection and are sick, then we would wait at least 10 days until that infection is cleared. On the next slide. Other conditions that are not contraindications nor precautions are immune suppression. So if someone is on chemotherapy or if they have HIV or AIDS, these are not contraindications. The vaccine may not work as well if our immune system is suppressed by these or chronic steroids, but it's not a contraindication, meaning people can proceed with vaccination. Pregnancy and breastfeeding are not contraindications. One may receive the vaccine with those states and with other chronic conditions. On the next slide. The third part of this is allergies to medications that are taken by mouth. If people have allergies to medications or to venom, bee stings, or environmental allergies, allergies to latex, or allergies to kind of grass, mold, pollen, ragweed. None of these is contraindications to vaccination. And I'll specifically ask about or point out latex because we do get this question a lot. The rubber stopper that's on the vials through which we drop the vaccine and the hubs that are in the vaccine itself, those are not made of latex. And so we've experienced no concerns or no risks from vaccination for the Pfizer vaccine. And similarly, I think for the Moderna vaccine for those with latex allergies. On the next slide. And just lastly, and I think this is the last slide, you are hearing about the Johnson & Johnson or Janssen vaccine. This was announced at the end of January that they had completed their phase 3 clinical trials. Their overall efficacy was 66% in preventing moderate to severe disease 28 days after vaccination, and it was 85% effective in preventing severe disease. This is good enough to help us achieve herd immunity, so no one should be fearful of getting, if this vaccine were approved, getting this vaccine over a Moderna or Pfizer vaccine. Serious adverse events were similar to those who received placebo. This was well tolerated. The FDA meeting is later this week. It is February 26th, where it will go before the FDA, and if approved for emergency use, then would go before the Vaccine Immunization Registry Group at ACIP for final sign-off before that vaccine would then become available. So I think that's it, and I will turn it back to our host. So thank you.
Thank you, Dr. Fish. I think that was an excellent and informative presentation, really touching on a lot of topics that people are concerned about and giving an overview of what's available to them. So our next presenter will be Dr. Ginny Mantello. Dr. Mantello was appointed by the Staten Island Borough President James Otto to serve as the borough's first Director of Health and Wellness in 2014. Dr. Mantello is an attending neuroradiologist at Montefiore Medical Center, and she serves as the co-chair of multiple large initiatives, including the Staten Island Child Wellness Initiative, the Staten Island Asthma Coalition, the Staten Island Medical East Ecosystem for Disaster Preparedness, and the Staten Island Economic Development Corp Health Professionals Council. Dr. Mantello works closely with public health-focused agencies and has played a key leadership role in coordinating the borough's COVID-19 response across multiple agencies and organizations. Dr. Mantello, we thank you for being with us, and the floor is yours.
Thank you, Dr. Corbo, and good afternoon, everyone. I want to start off by thanking Dr. Fish for that very comprehensive presentation. Thank you to Dr. Corbo and the Wagner College team for inviting me to speak today. I am hoping, I think Dr. Corbo covered most of what you need to know about vaccines. I'm hoping to sort of give you a little perspective of what is happening on the ground in the city as well as Staten Island. And just want to make sure, can you see my slides? Dr. Corbo, are you able to see my slides? Yes, great. So I'm going to give a little bit of a 30,000 foot perspective, and then I'm going to bring it down to a much more local level. You heard this already from Dr. Fish. Some very sobering statistics. We yesterday reached a new milestone with 500,000 deaths, which is really the highest in the world out of all the countries. And the US deaths account for 20% of COVID deaths, even though the population is only 4.25% of the world. And this actually is more deaths than in World War I, II, and the Vietnam War combined. So that is a very, very sobering statistic. We have actually about 28 million cases of COVID-19, and those are the ones we've tested. So obviously there's millions more that are either have been asymptomatic or mildly symptomatic that were not necessarily tested. And sadly, the life expectancy dropped a whole year due to the COVID pandemic, which is probably the first time such a significant drop since World War II. What also is interesting, you heard Dr. Fish mention herd immunity a couple of times. We really need about 80 to 85% of the population vaccinated in order to achieve that herd immunity. And we are currently, if you think about the United States, 13.3% of the US population have received the first dose, and about close to 6% are fully vaccinated. There are about 65 million vaccines that have been administered, about 74 million delivered. So just to also tell you that, you know, this is ramping up, and we have vaccinated a lot of people, but we're only still at 13.3% and 6%. New York State has immunized about 12.3 first dose and about 6.2 both doses. And now at a local level, Staten Island's actually faring better than the other boroughs. We've fully vaccinated 8%, about 7% partially vaccinated. And again, part of the limitation has been the lack of vaccines. And as you are probably well aware, the way the vaccines come down to the local or even the city level is they get approved by they get sent by the federal government to the state and then to the city and then eventually to the local level. So once you decide that you're going to get vaccinated, what do you need to do? And Dr. Fish alluded to this. Both the city and state have very comprehensive dashboards and websites that are created to help individuals, A, to figure out if they're eligible, and then B, to find a vaccine site near you. So if you are unclear whether you're eligible or not at this point, you can go to the New York State Am I Eligible app, and you can put in it'll give you a drop down. You can see if you're one of those that are eligible, and I'll talk in a second about who's eligible. And then you can go to the vaccine finder, the New York City vaccine finder, put in your zip code, and it'll show you the closest site that is adjacent to your zip code where vaccines are available. And then you can schedule through that, the website of that site. You can also, if you're not tech savvy, for seniors, for instance, there are certain vaccination hotlines that are set up both by the state and the city. And you can call those hotlines to arrange to get help for scheduling an appointment as well as transportation. Once you have an appointment, the state requires you to complete a vaccine form. Once you complete the form, you're all set. When you go to your vaccine appointment, you're required to bring either a proof of employment from your employer, a letter from the employer, or a pay stub, and then a driver's license, passport, or any legal proof of your date of birth if you're eligible due to age. And now, if you're eligible due to a chronic underlying health condition, either a doctor's letter or you can self-attest saying that you have that chronic condition. So again, many resources, and I will share these with Dr. Corbo and the team, and they can certainly send this out to anybody that's interested. All of these are live links. You can click on it to find out what the phased distribution of the state is, and we follow the state guidelines. And then you can also determine you can find out how to schedule an appointment or and look at the vaccine eligibility form that needs to be completed. As I mentioned, the state has a very comprehensive data dashboard, and I'm not going to go into the dashboard, but I'll show you a few snapshots. On a daily basis, this is updated. It tells you how many first doses and second doses were received or delivered to the state, how many were actually administered, and it also gives you a week by week how many vaccines were received by the state. And just to put things in perspective, currently we have 10 million people in the state of New York that are eligible, and we're receiving roughly 350 or so doses of vaccine, 350,000, I apologize, vaccine doses per week, which is really a very, very tiny amount considering there are so many people eligible. Last week, due to these multiple storms, we also had a delay in receiving the vaccines, and then that caused almost a standstill at a local level of first dose vaccinations because the city was down to very tiny numbers that they had available, and a lot of appointments had to be rescheduled. In the dashboard, you can also see cumulative how many doses New York has received, and how many of those were first and second doses. And at your leisure, you can spend some time looking through these various resources. In addition to the state, the city also has a number of resources set up. As I said, there's also an eligibility form or a drop down where you can see if you're eligible and who falls in which phase. There's the COVID-19 finder that will tell you if there's a vaccine in your neighborhood. And then there's a dashboard and a vaccine page that gives you more in-depth information on how the city is doing. And this is just a snapshot from this morning. Again, this is updated daily. It tells you the number of doses that were delivered, administered, how many first doses, second doses, how many the federal pharmacy program has given out. It gives you a breakdown by zip codes now, adults by borough, and you can go and see in your neighborhood and your borough how many have received the vaccine. So all really wonderful resources. So now at a Staten Island level, who's actually doing the vaccinations? So we have two hospital systems on Staten Island. And so the hospitals are being administered. They spent a lot of the first couple of weeks focusing on their own staff, healthcare providers, frontline hospital workers. Now that they are done with all of those 1A category, they have also opened up helping vaccinating the community. So they are, we're having the hospitals immunize individuals. They still prioritizing 1A before they prioritize anybody else. We have 5 federally qualified health centers. We have some local pharmacies that have received vaccine directly through the state, or now we have the federal pharmacy program that we have some chain pharmacies like Walgreens, Duane Reade, Rite Aid, even Costco that'll be receiving vaccines moving forward. We also have some local long-term care pharmacies like Annexia, VitaCare that has been tremendous in helping us immunize the congregate setting, group homes, developmental disability population, and now seniors. And the way the state has laid the guideline is that healthcare hospitals should be prioritizing healthcare workers, pharmacies should be prioritizing seniors, and then the city has set up hubs and they will be prioritizing the city workers. So there are 2 hubs for the general population on Staten Island. They're at Port Richmond High School and Staten Island Technical High School. We also have one at Susan Wagner High School, which is for city employees. In addition, the state has been working with us to set up pop-up sites at NYCHA developments and in underserved communities in the North Shore, and also the city has been allotting vaccines for those underserved communities at their hubs. We talked already about the vaccine finder and how you schedule. There are specific protocols in terms of scheduling vaccines at our 2 local hospitals. You can go on a website or call a local number that has been set up by one of the hospital partners. And urgent cares are also doing vaccines in the community. So just some local recent updates that were outlined by the governor and the state yesterday. So the good news is that the cases, the positivity are all moving in the right direction, not just in the state, but in the country. The trends are improving. The indoor dining was resumed on February 12th at 25%, is to expand to 35% this upcoming Friday. Good news for all the youngsters, movie theaters to open March 5th at 25% capacity. Wedding venues, catered events to be able to allow 150 as a maximum as of March 15th. You heard from Dr. Fish, there's 2 new state vaccination sites that are opening tomorrow in Brooklyn and Queens. Staten Island just added a mass vaccination city hub at Empire Outlets, opened last Thursday. Also, there's a new update on nursing home visitation guidelines to go into effect this upcoming Friday. And the other good news is that the federal government has increased its supply to New York State, and we're hoping they will further ramp it up in the upcoming weeks. I already mentioned some of the delays that were caused by the storms. So we're still trying to play catch up. So the not so good news or the things that we have to be still watching very carefully is that there are more infectious variants coming out that are emerging. And it's, as Dr. Fish mentioned, this is really a race now. We want to try to vaccinate as many as possible, try to get some level of herd immunity before any of these sort of take a foothold in the US. And we have 3 main variants and now a 4th one identified, Japanese variant. And currently about 154 cases of the UK strain, which has been the one that's been the most common in the United States as well. So in New York State, about 154 cases of the UK variant and 1 case recently identified of the South African variant in New York. The only other thing to mention, you already heard about the J&J, which is very positive news. There's been some updated guidelines that the CDC has made on mask wearing, and I know the state and city have also updated their guidelines. The new recommendation on whether to quarantine or not was put out by the CDC. We're still waiting for the state to adopt that guideline and send that to us. And the only other thing of mention is that the window to receive the 2nd dose has been extended by CDC to 42 days for both Pfizer and Moderna. Those are some of the more recent things that are happening sort of real time and at a local level. So with that, I will end by saying that each and every one of us needs to do our part in ending this pandemic. Even if you're vaccinated, don't forget to follow the core 4 and get tested if you have symptoms. And we need to be educated consumers and help guide those who need help. So thank you very much.
Thank you, Dr. Mantello. It shows how important it is for everyone who can and is qualified to get vaccinated to do so. So our next speaker is Dr. Tracy Jackson. Dr. Jackson is the director of the Physicians Program at Wagner College. She has been a physician's assistant for almost 25 years with experience in neonatology, pediatric, and adolescent medicine. A 1996 graduate of the Block's Lebanon PA program, she held successive roles in PA education, including adjunct faculty, clinical coordinator, and interim assistant dean and program director at the CUNY School of Medicine. Dr. Jackson was the president of the New York State Society of Physician Assistants in 2017-18 and a member of the Governance and Ethics Board of the Physician Assistant Education Association. Dr. Jackson is passionate about diversity, women in leadership, and mentoring the next generation of PA leaders. She's going to speak to us today about her clinical experience on the floor with vaccination and how that all will affect you. Dr. Jackson, thank you so much. The floor is yours.
Thank you so much. Thank you for inviting me to be part of this forum this afternoon and this webinar. Thank you to my colleagues who spoke so eloquently and delivered a lot of the information that's necessary for the public and for us to be able to move forward. I'm going to pivot a little bit and talk a little bit about my professional experience, right? As well as my personal experience. So the impact of COVID-19 is embedded in the global, national, and social narratives through our conversations and our lived experiences. The Centers for Disease Control indicated that over 27 million cases have been diagnosed. Of these confirmed cases, 500,000 deaths have occurred, of 1,438 for healthcare workers. Educator, my reason for supporting and to delivering this information about COVID vaccines is multifaceted. The pandemic has highlighted data and provided insight regarding social determinants of health and disparities in Black and diverse communities. Over 63 million vaccines have been administered to date, with 64% being administered among whites, 13.9 multiracial persons, 8.8 Latino and Hispanics, 6.3% Black, 5.1% Asian, and 1.7% Indigenous people. while the FDA authorized emergency use of, in December, of the Pfizer and Moderna vaccines, it's really important for the public to know that the similarities to SARS and MERS syndrome of 2003 and 2012 have provided foundational knowledge for the researchers to develop the COVID vaccine, as there are a number of similarities to the coronavirus. It is pertinent to share this information with those that have vaccine hesitancy, as well as the elderly, those that are undereducated, as well as those within Black and diverse communities, as there is a lingering mistrust and skepticism due to the historical uninformed recruitment and participation in research, such as the Tuskegee studies. The FDA and Advisory Committee Immunization Practices oversees and regulates vaccine research protocols and adverse reactions. The CDC and FDA are monitoring the corona vaccines for side effects and adverse events. It has been talked about earlier, and I'll reiterate this: they're using a self-check system and a health system that is called VSafe. This uses text messaging and web surveys for follow-ups. So it's important for you to know and to remember several things that were discussed earlier within this particular webinar. The Pfizer vaccine can be administered to those 16 years of age and older in 2-dose series, and we say it's 21 days apart. The Moderna vaccine has been approved for individuals who are 18 years and older, 2-dose series, 28 days apart. Both vaccines are noted to be at least 94% effective. They do not contain a live virus, and they do not alter the DNA. The most common side effects are pain at the injection site, arm discomfort, redness, swelling, fatigue, body aches, low-grade fever, and headache. So now I'm going to share with you my personal COVID vaccine journey. To date, I've had both of the vaccines. While others have reported challenges with scheduling appointment and access, I was fortunate enough to go online and find an appointment and schedule my appointment after taking a quick health status survey. The day of my appointment, I showed up at the site 30 minutes before time. I had my temperature checked. I did another in-person health status check. They took my vital signs, and then I was given, also they told me about and informed me about the possible side effects before administering the vaccine. After at vaccine administration, I was observed for 15 minutes, told about the VSafe app, as well as given documents in writing about the vaccine to take home. My side effect, just mild discomfort at the on the injection, which was alleviated with the COVID-19 vaccine, was important for me because being immunized is a way for me to actively participate to reduce the exposure of the virus, to have a positive impact in the communities I'm a part of, the academic, my residential, and familial community. It is a way for me to honor and support PAs and my healthcare colleagues, as well as the staff that work in hospitals that stood and stand on the front line during this pandemic. I did this for my family. I did this for my friends. I did it for the ones I love and the ones I've lost. Ultimately, it's not about me. It's about us. The vaccine is an alternative, and being immunized is the way for us to move forward. Together, we can combat this virus by building trust and decreasing barriers. This can be done by involving people from the community, such as leaders, nonprofits, community health service centers, FQHCs, and faith-based institutions. By listening, validating people's concerns, their feelings, and providing facts about the science to dispel misinformation surrounding the vaccine. So thank you again for allowing me to be part of this forum, and I turn it back over to you.
Thank you, Dr. Jackson. We're close to or a little at the end of our time, but I would like to get one or two questions out if that's possible. These questions were solicited from our audience as they were registering, and the most popular questions were kind of brought to the surface. So our first question for our panelists is, when will we know for, when will we know for certain how long the vaccine immunity lasts, and how often may we need to get vaccinated? For example, might we need to be vaccinated yearly like we do for the flu shot? Dr. Mantello, would you like to start?
Sure, but I'm going to defer to Dr. Douglas, but I think the answer is probably going to be the same. Only time will tell us that. We don't really have enough information yet. What we do know is that it protects us at least 90 days out. And beyond that, we don't have enough data to tell us whether we'll need a booster in 6 months, 1 year, or 10 years. So I'm going to let Dr. Fish comment.
Sure, I would agree. I think the studies are still ongoing, and even those individuals who participated in the clinical trials for Pfizer and Moderna are continuing to be followed. So we are continuing to gather that data as a field in science to really inform the answer to that question. It's an excellent question that everyone's wondering. Is this going to become an annual event? How long will the protection be? We know that from natural infection, the general immunity is around 90 days. If people have more severe disease, it can be a bit longer, but it's not necessarily forever. We're hoping that the neutralizing antibodies of the vaccine will last longer. As Dr. Mantello said, it remains to be seen.
Thank you both. Dr. Fish, we have another question that I would like to ask. What is the likelihood of people needing a third dose targeted towards the newer strains that are mentioned? And if so, when would those likely roll out?
So again, a very good question. The current vaccines really are working for the UK strain and many of the strains that we've seen. It is the South African variant that it does raise some concern. That has been a recent case identified, as was noted by Dr. Mantello, in New York State. So again, I think additional information will be needed, and additional studies, particularly directed at that strain. We do also have other vaccines that will be coming on board, we hope, that are currently in investigation. There's not only the Janssen vaccine, there's the AstraZeneca vaccine. Novavax has started clinical trials in the US and Mexico to try to inform some of these questions. It's too soon to tell, and I don't know when we'll have the answer to that. And I don't know that a third vaccine of our current vaccines necessarily would be the answer for a strain if it's not working against that strain. So I think we don't know yet, but we will continue to learn as we're learning every day in this pandemic.
Okay, thank you all. So that concludes our webinar for the day. I'd like to thank our three panelists, Dr. Fish, Dr. Mantello, and Dr. Jackson, for sharing their experiences and their information and knowledge with us today. And I thank every one of you for joining us at Wagner College's vaccine webinar. And I look forward to seeing everyone talking about their newly acquired vaccine as soon as they are eligible. Thank you all very much. And thank all of those who have joined us today.